Okay, umbilical cord clamping is a big question on every woman's mind when you're giving birth. Do I wait? Do I not wait? What are the risks? What are the benefits? So delayed cord clamping is one of those things that a lot of women look for information on. And it is a really big benefit to the baby, and it just depends on your provider on what they consider delayed cord clamping. So once the baby is actually born, it's in the past they used to just cut the cord right away, and now it's kind of going back to the trend of waiting a little while. Some obstetricians say between 30 and 60 seconds is delayed cord clamping. Some midwives will say between 2 and 5 minutes. It just really depends on your provider and what they're comfortable with and what you choose. You can suggest a time frame. It may or may not work depending on your provider, but know that it is a benefit to the baby. It will increase their iron levels and their hemoglobin levels. They're going to, they kind of look at the cord to wait for the pulsating to stop, and then they'll clamp it from there. So a lot of times that kind of depends on the amount of time that they'll wait as well. A pretty average amount of wait time is 2 minutes for the delayed cord clamping. One of the risks that can happen is it will increase the possibility of jaundice slightly, and so they'll just look out for that if you're going to have delayed cord clamping. And it's not a huge issue, it is just something that the provider will look out for after the baby's born and the first couple days of life. For preterm babies, it is said to be really beneficial for delayed cord clamping if it's possible. Sometimes those are emergencies and that's not possible, but if it is possible, it does help with the increase in the hemoglobin and the iron again, but it said that that gives them enough of that blood volume so they won't need a transfusion later on if they're preterm, which can happen a lot. So it is very beneficial to the baby, and just make sure you talk with your provider on what they're comfortable for a time frame. The other part to that is cord blood banking. So what is it? Well, when the baby's born, they clamp the cord. You'll have a little kit that was sent to you by whatever company you choose to use, whether it be private or a public cord blood banking company. And some hospitals even have the kits in their facilities. You just have to kind of ask and check with your provider on what's available in your area. But they'll collect the blood out of the umbilical cord into the kit, and then they'll send it off, and it actually gets stored and marked. First thing they'll do is they will test the blood to make sure that there's no genetic abnormalities or any underlying diseases or anything like that. So a private blood bank will be one that is basically saving the blood for you or your family members to use. So if you have somebody in your family that has an autoimmune disease or something that could benefit from stem cells, it would be beneficial for you to save the cord blood, and then you would pay a company to keep it privately for just specifically you and your family to utilize. If it's public, then you're going to send it and you're basically donating it. So they're going to code it as a certain type of blood, and then they'll match it with somebody who needs it that's unknown to you. So the benefits of it can really help somebody else out if you're willing to donate it to a public blood banking. If it's private and you do know somebody in your family that might be having some kind of illness, then that could be beneficial to your family as well. Again, this is another one of those options that is entirely up to you. You get to decide if you want to save your baby's cord blood or not. It's not good, it's not bad, it's just that's what it is. And so just check with your provider on what's available. If you're interested in it, you can look up online to see any companies that are around your area so that you can get the kit and get that banked up if you would like.